Hi everyone, welcome to Get Well with Dr. Shel. I am Dr. Shalina Lalji, better known as Dr. Shel, and I know as a board-certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. And I have a special treat for you that you're going to really enjoy. A very good friend of mine, Dr. Keesha Ewers, and I am super excited to have her here with us today. Dr. Keesha has been in the medical field for over 30 years. She is board certified in functional medicine, a doctor of sexology, a psychotherapist, family practice advanced registered nurse practitioner with a specialty in integrative medicine, a certified advanced Ayurvedic practitioner, and she's the founder and medical director of the Academy for Integrative Medicine Health Coach Certification Program. After conducting the HURT study in 2013, HURT stands for Healing Unresolved Trauma. She developed the HURT model for understanding how past childhood trauma impacts adult health. This led to the creation of the Unbroken online program for patients to heal their own trauma and the Mystic Medicine Deep Immersion Healing Retreats that she leads at her beautiful home in San Juan Island, Washington. Dr. Keesha is a popular speaker, including at Harvard and from the TEDx stage, and the best-selling author of Solving the Autoimmune Puzzle. You can learn more about this wonderful leader and find her programs at drkeesha.com. I am so thrilled to welcome my wonderful friend, Dr. Keesha Ewers. Welcome, Keesha. How are you?
Oh, I'm so good. Thank you so much for having me. I really look forward to talking about favorite subject, hands down.
Absolutely. It's so good to have you here. So, Keesha, autoimmune disease is now the number one chronic health problem. Functional medicine offers really sound treatments, as we both know, since we practice functional medicine for, a few decades, but it is so often missing a critical piece of the puzzle. So let's jump right in and talk about trauma and grief and how these can become seeds of actual physical illness for people.
Yeah, as you said, autoimmune disease is on the rise rather than coming down. And it can take anywhere from 10 to 30 years to develop an autoimmune disease, a full-blown diagnosis. Mm-hmm. So many of the people that are listening to us right now don't know it, that they could be developing autoimmunity, right? And the way that I think about it is that means that we're attacking ourselves. There are systems within that are not collaborating very well. And anytime you're in a combative relationship with yourself, there can be no winner. So when we think about that, when I was diagnosed with rheumatoid arthritis when I was 30, which is 25 years ago, I was able to reverse it within about 6 months because I really dove into, I'm killing myself.
Yep.
Why do I want to die? Mm-hmm. Now, people might hear me say that and go, but I don't want to, because at the moment that I was diagnosed, I didn't either. Right. And so I thought about this and I thought there must have been some time when I maybe wasn't doing so well with, wanting to be on this planet. And I had read a little bit in my research about other ways of treating autoimmunity besides the prescriptions that I'd been handed in my first doctor's appointment with methotrexate and a non-steroidal anti-inflammatory drug.
Right.
And I thought, And so I had gone on and I had looked at PubMed and I looked online and I found some research about yoga and autoimmunity. And that led me to Ayurvedic medicine and autoimmunity. And Ayurveda says that autoimmune disease is undigested anger. So as I was looking at that, I had learned how to meditate. I'd learned how to do yoga, at this point after getting diagnosed. And so I'd gone back in this little, I call it the breadcrumb trail of my memories to see, is there a time when I wanted to die? And I took with me that information from 10,000 years ago, this Ayurvedic principle that autoimmune disease is undigested anger. And so that kind of tracking for that, like, where is there undigested emotion in me? It can be grief or sorrow or anger, but just something that hasn't been processed properly, right? And I arrived back at this 10-year-old little girl version of myself who was being sexually abused by the vice principal of my elementary school.
Oh my gosh, you're breaking my heart right now.
And I just remember looking at her and thinking, I could see her in my mind's eye. She wanted off the planet.
Yes.
She had grief. She had anger probably, but she didn't know. Like she had terror and panic, like all kinds of emotions. And she didn't understand what was going on, had tried to tell people about it a little bit, but didn't have the right language. And so when this 30-year-old version of myself visited my 10-year-old version, I went, oh, you did want to go. Like you didn't know what was going on. You couldn't understand it. You didn't have a way of processing these emotions. And so, of course, this has to have something to do with what's going on today. That my cells took that and said, oh, yeah, well, sure enough, science tells us that's true, right? That our early childhood trauma does impact, and that grief that's stored. And if you were living in a village in Guatemala and part of the Mayan tradition, right? The things that the Mayans always said is that cancer and autoimmune disease, chronic illnesses like that, are petrified sorrow.
Wow.
And that it's the community's responsibility to come together and witness the liquefying of that sorrow.
Wow.
That supported in that space where you can actually grieve and you can move through and let this digest instead of having it locked inside of your system and all of your tissue, right? And to create this like combative relationship between all of that. So we've lost sight of that, and COVID's not making it any easier.
Oh my gosh, yes.
First of all, we didn't even have the language for that, and now we're separated. So, there's so much grief in Rupert Sheldrake called this the morphogenetic field, the energy that we are all joined in, right? That we pass information to each other through.
Yep.
That morphogenetic field right now is filled with grief. It's filled with sorrow. It's filled with terror and panic, right? All those things that this little 10-year-old individual felt back then, but we're all feeling that right now, right? We're connected.
Combined energy that we're feeling from each other, and the energy travels way beyond, any place that we can travel. It just exists all around us. You're absolutely right. And the last 12 months have just been all of that negative energy in our atmospheric field, in our energetic field. Thank you for explaining that, because, a lot of our listeners probably find a little relief from that, right? Because there are people who don't know why they have different autoimmune diseases, or why did they develop cancer, or why did they develop other chronic neurodegenerative diseases that they just have no idea. Here we are living a great, healthy lifestyle, eating right, exercising, doing all the right things. And wow, where did this come from? And this is the missing piece of the puzzle in so many people's health. I'd like to take a moment to honor all the families in the world right now who have lost a loved one from COVID. That's over 2 million families to date, including my own. As you know, Keesha, I lost my sweet, incredible, amazing dad just 3 weeks ago. And when you have that kind of loss and grief and sorrow, that affects health and, vitality. And I mean, you see this IV going in me right now. I've got this on me right now because I'm just spent and exhausted because in our culture, in our world right now, unfortunately, we as humans are not getting or giving ourselves the time to properly go through the emotions, the grief, the loss, processing things. And like you said, I think it's one of the Mayan traditions that when there is a death in a community, they actually go and make sure that the family members cry and cry and cry so that everything comes out. So what do you say to
We're in
people?
charge of the weeping.
Yes.
They are the ones that begin the community and the
Yes.
weeping, right?
Yes.
So instead of
Yes.
being told you're too sensitive or you're too much, you
Yes.
actually have this role in the community that says you are the one to start the process of releasing the grief, right?
Mm-hmm. Mm-hmm.
For the person that's been told since they were a child that they're too much or too sensitive, right?
Right. Right. So you had rheumatoid arthritis that you healed for yourself in 6 months, which is awesome. And I know that kind of propelled you to want to do this for so many others because you were onto something. And since then, you've helped hundreds of thousands of people to
Not
identify.
about hundreds of thousands, but
Well,
yeah.
your reach is farther than you think, Keisha.
Okay.
So there you go. We use all these different ways of reaching people, and then this person tells this person, then this person. So what we do, I think we do to help even one, and we're happy. But fortunately, this kind of information, I think, travels very quickly because people are looking for answers,
Yeah.
right? So let's kind of connect the dots one more layer. And let's share how trauma is often a family illness, with one person perhaps becoming ill, like in my own family with my husband having ALS, for example. And then everybody around, whether it's your immediate family, your extended family, needs to then integrate that stress and the fear and the emotions and the impact on their lives. So, how do you feel like if it's not your own trauma, but you're dealing with somebody else's illness who you love, how does that affect people when you see them?
That's a really beautiful and interesting question. And I want to kind of start with um, when I was a home health nurse
Mm,
and I would go visit a family that would perhaps have a Downs child.
right.
And the way that I would describe it is, and it doesn't start out this way, right? Because at the point that I'm seeing a child that's 7 or 8 years old,
Hmm.
there during the pregnancy and the delivery of the news that your child's not what you were expecting, and then the infancy and the growing up to that point. By the time I am arriving on the scene when I'm witnessing this, I used to call it shiny families. And that was my word for it. It was the only thing I could really describe that came out, and it was sort of like this refiner's fire where Rumi has a poem that says, if you're irritated by every rub, how will you ever become polished, right?
Wow. Yeah.
So I love that poem because that's how it was like this shininess in the family. But over the period of time that where this began, where the trauma of broken dreams and broken hearts and grief and all of the sorrow and the pain that went through that, I was witnessing on the other side of it what had happened going through that refiner's fire. So I am going to point to that as one thing. And
Sure.
then to get to that point, right? So that's a properly digested emotion when you get out to that place where you can see that there's this brilliance.
Yes. Yes.
And this light that just shines because you've been through that fire.
Well, it's sort of the hero's journey, right? You go through the fire and you come out. And it's interesting, you mentioned Rumi. He talks a lot about suffering being a gift and
Yes.
suffering being grace. So we'll get to that in a second as well, but please finish your.
That's why I wanted to start there, and then we would move backwards because it's not an automatic that you get there. That's not a guaranteed place that you're going to arrive at.
Mhm.
There has to be, and I call it 2 words that have to be used as part of the smelting to get there.
Mhm.
One of them is willingness. That word is so important. And in my study, my healing unresolved trauma study that I did, the hurt model has this, like, you have to be willing to make that true. And
Right.
the second most important word in the process of digesting this experience that we have is integration.
Mhm.
There's a story that's told about the Buddha had come to a village and was teaching. And a woman came in during his teachings, and she just like ran in and threw herself at his feet and said, "Master, I know you can help my baby. My baby woke up not breathing." And she was just grief stricken, right? And the Buddha looked at the baby and looked at the mother and with great compassion said, "Yes, I can help you." And said, "Go to the villagers and bring me back a mustard seed from every home that has not had death." And she said, "Okay, okay." And she went to every door and knocked on the door. And every time she would ask, "Have you experienced death in your family?" They would say yes. And then she couldn't have a mustard seed. And she went and went and went. And finally she came back and she said, "I understand."
Mhm.
And went about the process of grieving and burying the baby and going through what needed to happen next. And I love that story because in all of our lives, we are going to have these seemingly, you mentioned the hero's journey, insurmountable, right? Things that
Right.
we cannot handle.
Yeah.
And different families, if you become a caregiver family for somebody that's ill within the family, then you have that crucible right there in your family system, right?
Right.
And in 1995 and 1997, a study was conducted called the Adverse Childhood Experiences Study, the ACEs study. And it was a study that was done on Kaiser Permanente enrollees of over 3,500 of them, you know? And what they were asking is, before the age of 18, kind of like the Buddha said,
Mhm.
right? Before the age of 18, did you experience any of these 10 types of trauma?
Mhm.
And those are code I call capital T trauma. So domestic violence, sexual abuse, psychological, emotional, but also a family caregiver that is otherwise engaged.
Hmm.
So whether it's drug abuse or mental illness or incarceration or
Mhm.
divorce or death, you can
Mhm.
put into that a caregiver that is ill,
Mhm.
the other one's caring for them.
Right.
That's actually going to be registered as an adverse childhood experience for a child in that family.
Right.
And when you think about it that way, it doesn't have to be that way if there's willingness, right? It's like, oh, no, I don't want that to be this way. So we're going to make sure, right? But it
Mhm.
is going to be traumatic,
Yeah.
right? This family situation, because again, right in front of us, I just remember when I was pregnant, I was exposed to a harmful virus, and I was told there was no way I was not going to have a baby that didn't have some effects from it.
Wow.
And I remember doing this cross stitch as I was rocking when I was pregnant with her, and just getting ready for whatever was going to come. Like, I wasn't going to have an abortion. I just was getting ready for whatever it was.
Yes.
And getting ready, and I was in my head going through like how our family system, the three older kids and my husband, and how we were going to have to adapt to this new challenge, right?
Mhm. Mhm.
Knowing I couldn't ready myself enough, but I could actually start to dissolve. And that's what I would do with each stitch in this cross stitch as I was doing this. And I
Right.
was going to dissolve any hard and fast expectations that I had,
Sure.
what my family was supposed to look like,
Mhm.
how
Mhm.
everything was supposed to behave and act like, and
Yeah.
that, oh, okay. And she was born with no problems. And she's
Well,
23 now and beautiful, and there's nothing.
well,
You know,
that positive energy, the energetic field was so positive around you.
however, like, there's also karma, and it's not necessarily a bad thing. I don't think of these things as negative or positive. And so I was ready to bring her lovingly in no matter what. And the process of doing that,
Yeah.
right, of dissolving hard, rigid expectations and pictures and goals of what I thought needed to be, and then allowing the divine to just act in that space.
Right. Right.
that was a very powerful moment for me. That, those few months of me just kind of rocking and doing that cross stitch and just like letting go. And there is a saying, we make plans and God laughs.
Right. Right.
Yeah.
And you're absolutely right. Right. I mean, everything that you're saying, I think that it's really important to have a certain level of detachment from outcome.
Yeah.
Right. And I think that, what I always say when people ask me, about our journey for the last 4 years is accepting, loving, not just accepting, but loving what is.
Yeah.
And
Loving.
not feeling like, that whole feeling of I've been gypped and my childhood was taken away, or my adulthood, or, my dreams are broken and things of that nature. Now, having said that, that's human nature, right? I mean, we'll all have those thoughts. Give yourself the permission to have those thoughts. Be there with those thoughts.
Don't judge.
Don't judge them. Accept yourself. Be kind to yourself. Really nurture yourself, because these are natural thoughts for a human being to have. And then try to let go of them. And, accept it when they come and let go of them when you can, so that you can live in the present moment unattached from any outcome, because we don't know what any outcome could be. When we were first diagnosed, and I always say we were diagnosed because our family was diagnosed.
You're exactly right.
It's not just my husband, it's our family was diagnosed. So when we were first diagnosed, Mayo Clinic actually, took me aside. And when I asked them the tough question, because my husband's progression, even in the first 2 months, was so rapid, they told me it's going to be 6 to 9 months. And it was just like somebody put a dagger through my heart. And it's now been, by the grace of God, close to 4 years. And we are just grateful every second of every day to have each other and to have this beautiful time where we're just happy. We don't think about, hey, will these functions come back? Hey, when is the cure coming? Hey, that used to be me the first year. And you and I have met and spoken about this in the past personally, but that was me, like a little hamster in a wheel, go, 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 go. Thus the cancer, because I wasn't accepting my reality and all that trauma was internalizing. But I feel like I'm in a beautiful place now. And that's the transformation you speak about. That's that gift at the end of it, right? And it can also be during it, but it takes time. And I think it's important for people who go through, whether it's childhood trauma or adulthood trauma, to realize you're not going to probably get to that gift stage immediately.
No.
We have to go
through, because you don't grow and go and get the polishing.
Yes.
You can't bypass the steps.
No.
It has to go through. And some people will never get the polishing. If you don't have the willingness and then integration part, right, to do what's happening. The other thing about that, like the ones who come up and are mad and are like, this isn't fair, those I actually have you name those parts of you. We have a cast of characters within us that make up our ego. We aren't just a personality, we're several personalities.
Sure.
Anyone that can that hears my voice that goes, what? Can kind of rest into, well, who are you when you're in flow? And who are you when you're angry? And who are you when you're crying and you can't get your words? Each one of those is a different age and stage of your development. And it's a different character that's in there. And I always think about them all living in the cavern of your heart. And who you really are is this essence nature that's part of the divine that knows that everything on the planet is impermanent. Everything, anything we can lay our eyes on is impermanent and will die or deteriorate and disintegrate. And so we can live with that reality, like, oh, that's the only truth that there is. What is made and born will die.
Yes.
You can kind of go, oh, that essence part of me, just knows that my consciousness moves on from there and keeps going, and that this dies.
Mm-hmm.
That one is the one who's in flow. That's the one that is accepting and is peaceful and knows the spiritual dimension of all. But there's also the one in there who's 5 years old, perhaps, who's saying, don't leave me, don't abandon me, you know. Or there's one that's a baby who's pre-verbal, that's in the crib crying to be picked up and loved. And, you know, like those parts, there's the rebellious teenager inside of us. Every age and stage we've gone through still lives within us.
Mm-hmm.
Those will sometimes come out as the voice of, you know, those dimensions that you were in this lifetime. And
Right.
they have something to say. And it's important to listen to them and to love them and to say, I hear you and I've got you.
Yes.
And not to say, grow up, move on, you know, those kinds of things, or you're too sensitive, or, you know, any of those things. We want to be able to give all of ourselves
Yes.
space, right? And that's the way people will say, well, then how do I digest my emotions?
Mm-hmm.
You find one that's feeling it, and you
Right.
help them process it.
True.
That's the digestion of emotions. And eventually, as that gets processed and healed in each one of those parts of us, then everything's integrated, right?
Right.
Now you're in alignment, and now there's peace, and there's an ability to be able to have that overall larger view of life, right?
Correct.
You can't get there from a 7-year-old's perspective who only can think about like what's going to happen tomorrow, possibly, or the next holiday, or my birthday. You know, doesn't think about the larger perspective.
Sure. And, you know, I think that before we go away from the grief topic, because I think that especially now over the last, 12 months or so with COVID, there's just so much of it in the world. I want to read my favorite, one of my favorite poems by Rumi on this subject. I saw grief drinking a cup of sorrow, and I called out, "It tastes sweet, does it not?" "You've caught me," grief answered, and you've ruined my business. How can I sell sorrow when you know it's a blessing?" And it's so hard. Love that. It's so hard when you're in the thick of things to think of it as a blessing. And I know some people out there are saying, well, gosh, this doesn't make any sense. And I think all that you and I are trying to say is wherever you are is where you're supposed to be. Just know that there is potentially a gift at the end of this. And just stay with it and have faith and trust and compassion for yourself. So I'm glad we
one more thing about that.
Sorry?
I want to say one more thing about that. In the East, there's a goddess that is she who is never not unbroken. So she who is never not broken is how she appears sometimes, and then sometimes they'll say she who is never not unbroken. And she who is never not broken is the one where you see that imagery of, you know, how Rumi says it's through the cracks that the light shines, right? Really? And so that sorrow is the sweet cup that grief drinks, because it's the one that breaks open the heart. Absolutely. If you're happy, you're not breaking open your heart. You're not moving into the developmental level. You're not having to say, oh, you know, and finding God. You're completely complacent with where you are, you know. And I always say happiness is the place where we coast. And other stuff where we're actually breaking it all open and we're learning how to expand and shine our light,
growing and transforming. And and you're right, that's another really beautiful thing where you kind of picture if everything is just mended together, the light cannot shine through. When you have cracks, that's where the light comes in. So it's a really beautiful imagery. And I think we learn a lot from the East-West combination that we both love to practice. So let's shift gears a little bit and talk about the hurt study. Can you tell our listeners what exactly is the hurt study and what did it indicate and reveal that we all need to know about?
I was very curious about this idea that had the data that had come forward out of the ACEs study, where they were asking, before the age of 18, did you experience any of these big capital T traumas?
Right.
And what their findings were is that each check mark that you said, yes, I had that one. Yes, I experienced that one. Yes. That became an ACE score of 1, 2, 3, 4. And that the higher your ACEs score, the higher was your risk for all of the chronic illnesses we see in our culture today, as well as a number of other things. Amongst them, I thought was most fascinating is an unwillingness to engage in self-care.
Interesting.
And so, and the unwillingness part was also around wanting to continue to stay in a place of blaming anything outside of you, or blaming God or blaming life for your reality. So to me, the best self-care is what we've been talking about, being willing to be part of like the instrument in God's hands, and to say, just play me. And however that looks, the song will be beautiful if I can surrender myself to the whole process. Right. So the higher your ACEs score, the less the willingness was for that.
Okay.
So I did a study, and I thought, I was looking at female sexual desire, because a lot of women were coming into my practice asking me for bioidentical hormone replacement. And when I would ask questions like, why do you think you need hormones? I would start getting things like, well, I don't have any libido. And I would say things like, well, when's the last time you did have a libido level that you were happy with? I would get tears. Or I would say, do you like your sex partner? Tears. And I would go, oh, and there were stories, so many stories of pain and hurt that had obviously not been processed yet and digested.
Right.
And so I went back to school and I did my PhD in sexology, because I was very interested in the component of relationship to past stories, self. And then the way I think about sexual desire is the way Ayurvedic medicine talks about it, where they think about this word ojas, which is life force vitality. And so I was asking women, if you had this happen before you're trying to engage sexually with a partner, are you able to engage? And it doesn't seem like, it seems sort of obvious. Like usually the answer would be no, if you forgot my birthday, I don't want to have sex with them, but what was coming out of it was there was an unwillingness to forgive. And a reliance on something like hormones to bring libido forward, when this whole piece up here wasn't being processed.
Correct. Yeah.
So what emerged from that study was the hurt model, which shows that when you first have a hurt, something happens, and all of us do. A form of betrayal, rejection, right? Feeling not good enough, not fast enough, not smart enough, not fleet enough. When we're children, we're biologically wired as humans to know that if our tribe rejects us, then we are put on the outside of the firelight circle, a saber-toothed tiger can eat us. So what I started discovering was, we have this initial hurt when we're children, and our child mind, our brain is not fully developed till we're 26. We don't have this prefrontal cortex online yet.
Right.
So that hurt happens during that time, which then gets our primal brain engaged. We go into a fight, flight, freeze, or faint.
Right.
And we're going to make up a meaning. And this was the part that I'm finding most therapeutic models drop. They don't come up with this part. They start with the behavior of the trauma and end with the behavior of the trauma, but they don't go to what do you as an individual who experienced this thing, what was the meaning and the belief that you created in response to it about yourself?
Right.
This is why people that say I'm an emotional eater, or I self-sabotage, or I'm good and then I'm not good on the wagon, in functional medicine protocols, this is why it's not about willpower.
Right.
So it's a belief that you created and so I always use mine. I say, okay, I'm going to bring you on my big hurt, and I'll help you track it because it's easy. So I'm in fifth grade, the intercom goes off in the corner of the classroom to say the Pledge of Allegiance every morning. And I go into fight, flight, or freeze, because it's that intercom that calls me to the principal's office. So every time it crackles to life, I'm in a terror.
Right.
And that's Pavlovian, right? It's like a conditioned response.
Right.
So the vice principal, this only happened occasionally, just a few times, but all year long, the intercom has me there again.
Right.
So what the vice principal told me is I was a bad kid and I was white trash. I was in an all black school. I was one of two white kids, and he was also African American. And so he was telling me it's because I was a bad white trash, right? So I'm in this school kind of looking around going, okay, the people that say that they're here to take care of you are actually, they can't be trusted. So the meaning that I create is people in authority can't be trusted.
Mm-hmm.
Still a little bit edgy when I go through TSA.
Yeah.
A little bit watchful,
Yeah.
So,
Watch out. Here comes Keesha.
I know the belief system that I created from that then, which has a behavior you're going to create as it's an adaptive response from a child's brain, okay?
Sure.
Is that I need to be perfect to even survive. Okay, so if I'm bad, and then I'm also going to learn how to be super protective, and I call it chameleon, right? I can kind of blend into any little group. I start watching and I see, because I was a sore thumb, in that grade where I was.
You want to blend in. You learned that was the better thing to do.
That was safe, right? That created more safety if I could just sort of blend in. So those are my behavior strategies. Okay. So the hurt model has this initial thing that happens, and then it has two wheels that come off of it. And over here is one, it says, if you never ever self-confront, and you never realize the meaning and belief that you created in response to whatever happened, and it doesn't have to be capital T trauma, it can be anything, lowercase t trauma, then you're going to continue in the same way you did from that primal brain. You're going to ruminate, you're going to judge, you're going to go into that fight, flight, or freeze. And we already know that we're not designed to be able to continue that loop. So in the middle of the loop, it says unwillingness to self-confront will wind up with disease. The other one says that if you do say, okay, I'm on the hero's journey, I've just gotten a challenge, I need to find a mentor, I need to learn how to do this, I need to integrate, this is about my response to life. That's willingness to self-confront. I do my trauma work, I do the mirror work, I do my forgiveness work, I do all of that. Actually, that leads to freedom from disease. And I've lived that twice in this lifetime so far. So I was able to reverse my RA within 6 months using that. And then 10 years later, my second son, came home from college and sat me down and said, Mom, I have something I need to tell you. And I said, oh, this sounds serious. And he said, it is. And he said, my brother and I don't know about our sister, so my three older kids. The babysitter in the neighborhood that you left us with a couple of times sexually abused us.
Oh my gosh.
So there's this moment that I will never forget that's burned into my mind, right? Of
college when he told you this?
Yeah, looking at him across my dining room table.
Wow.
Just wailing, just losing it because of all the things that I would have wanted to protect my children from. And I didn't. And I was 100% to blame for this, because I can remember standing at the sliding glass door with my baby on my hip, opening the door, looking at the kids playing with the neighbor boy who was about 8 years older than them, jumping on the trampoline, saying, hey, saying his name, do you want to stay and play with them? And I'll pay you to babysit. I just have to run to the grocery store for an hour.
Oh my gosh.
See that moment.
Yeah. You just wanted to take it all back. You wanted to tell him to get out of your house and never come back in.
100% my fault.
Well,
no, hang on.
Yeah. So let's go there.
When Colin told me, this is really important though. I mean, that was my responsibility to keep them safe, right?
Right.
We as parents can't always, we make bad decisions.
Sure.
So my son told me this, I lost it. I said, why didn't you tell me before now? And he said, because of this. I didn't want you to define our childhood by this one event.
Mm-hmm.
So I looked him up. I found him, the perpetrator. I called him and he said, oh, I've been waiting for this call for years.
Wow.
And then I knew like it had also haunted him.
Mm-hmm.
So
Mm-hmm.
I said, I have a few questions for you. And I talked to him and I facilitated this whole like process between my kids and him. And I had him pay for part of their therapy. And I mean, it was this beautiful thing that happened. It was amazing. And the kids responded really well to I mean, it was just amazing. 4 months later, I got diagnosed with breast cancer.
Mm.
The tumor was right over my heart and my left breast.
Left breast. Yep.
I was the ultrasound wand was over it, and I was looking at it, and I was seeing the blood supply to it. It was so healthy,
Yeah.
so fed. It was just receiving everything it needed. It was so beautiful in there. And I looked at it and I said, I know what that came from.
Mm-hmm.
And I could see like in the vasculature of it, it was my guilt and my shame and my devastation and just despair that had happened to my children on my watch.
Yep. Yeah.
And so I said, I need about 30 days and I'll be back. And then we can go through everything that needs to happen. And in 30 days, it was gone.
The tumor was gone. Your tumor.
The ultrasound wand was there and the vasculature was hanging and there was just empty space. And I knew where that had come from. When I saw it, it's like it was all inside of me, the shame and the darkness and like I wanted to kill myself for what I had done to my kids. Right. And I was busy doing it.
Right.
So
right.
For 30 days, I went into this like dark space and I had to heal it. I had to go and forgive myself. I had to release that shame and I had to get on that larger perspective.
Right.
Essence nature that knew that there was karma, dharma, impermanence, like all of it was in there. And that this was just a moment in time that had been enacted for some other reason that I don't know.
Right.
And that it's not all about me.
Doesn't define you, and it maybe has nothing to do with you.
Absolutely.
You know, and we're just a small, teeny, tiny speck of a dust in the entire spectrum of things. And I think,
and I got the arrogance of where I was too. Like I was fully responsible, right? Like there was no other sat with my kids and I talked to them about this. And of course they had forgiven me, like no problem.
Sure. They probably weren't even blaming you. It's the whole self-shame that even Brene Brown talks about quite a bit, right? The shame and the vulnerability that we're almost creating this story. So we're telling ourselves this story where, of course, we are the superstar of that story, or we are the main, either the hero or the villain of that story, depending on what the perspective might be. But we really should not be, so engrossed in it's us. It's all about us. We can't be so arrogant, right? We can't be so arrogant.
Arrogant.
Yeah, we just because it really, we have so little control. We have so little.
Who made the tea and gave it to them, right? Like I was the teacher in that moment that actually facilitated something much bigger in the whole eternal perspective,
right?
And for me to take all of that and say I'm the only one in the whole story is so arrogant.
Yeah,
and I just got it. I got it.
Yeah. And that's the great way of forgiving ourselves too, because, if anyone who's listening out there is part of a story that may be similar or different, but where you feel shame, responsibility, guilt, blame, vulnerability, realize that you were just a part of this entire universal thing that was happening. And it really was not all you. It cannot be. There's too many prayers out there.
I was in meditation and I was weeping at the foot of the cross that Christ was being crucified on. And
Mm-hmm.
I looked up and I went, oh, because Christ was very lovingly looking at me and saying, are you asking to get up here and that what I'm doing is for nothing?
Mm-hmm. Mm-hmm.
Oh,
Mm-hmm.
and,
Okay. Okay.
right? Like, okay, this is the
Absolutely.
archetype. This has been done already. So this is not for me to get on that cross and take on everything.
Exactly. And I think that, forgiveness is a really big part of health and well-being.
It's,
Forgiving ourselves, but also forgiving others who might have hurt us knowingly or unknowingly. Because when we don't forgive, it actually hurts us more than it hurts them, because we carry these negative emotions as part of our everyday existence. And all of those emotions, whether it's blame or guilt or anger or sadness or anxiety, those are all emotions that bring your frequency down and don't allow ourselves to heal. And our body is such a self healing mechanism, but we need to allow it to heal by giving the positive vibrations into our body and in our surroundings. So I think that's a really important point that we are speaking about today, that for everybody out there that's listening, the pain that I'm sure, there's no one person that hasn't had pain or some sort of trauma or grief or sorrow or loss. But whatever that may be for you, number one, forgive yourself if you're holding it deep inside. Number two, try to process it and try to live it and try to be compassionate with yourself, and then only can you have a healthy mind, a healthy body, and a healthy spirit. And it's so important to understand the role of trauma, which is why I really wanted to interview you, because you're one of the experts that talks about that so much. So before we end, Keesha,
I want to add one more thing to that if
yeah,
you
please do.
to kind of bring a visual to people. You have an IV in your hand right now.
Yeah.
You show it.
There
Okay,
it is. Yep.
let's pretend like we have a bag that we're connecting to your IV and we're opening the roller clamp.
Yep.
And what's on the bag is called resentment.
Mm-hmm.
And you were just like putting that into you intravenously, so it's a poison.
Sure.
We know that you would die, right? Whatever poison we put in you intravenously is going to very quickly do you under.
Right.
So I always tell people, like, resentment, that is, if we're using that as the hot tub that our cells are bathing in, right?
Right.
If it's resentment, then we are literally killing ourselves, and that you have to take the little plug out of your bathtub and let the resentment drain out.
Mm-hmm.
Nothing
Mm-hmm.
to do with anyone that's hurt you. Nothing. It has everything to do with you. And, the Chinese have a proverb about that. Don't forgive, dig two graves rather than one. Because that resentment is the most toxic substance I can think of on the planet. It's
Mm-hmm.
not manufactured by large corporations and dumped into our air, soil, and water. It's manufactured right here. And we're
Right.
the ones that do the dumping. And
Yes.
so if you can't get that landfill removed from your system, and it's not a liver detox and it's not colon hydrotherapy, it is an emotional, spiritual, and mental detoxification of resentment. That has
Absolutely.
to happen. Otherwise, no diet, no supplement regimen, no medication, no amount of sleep is going to do any good.
You hit it right on the nail. Whenever I have patients who come in for, gosh, from hormone replacement to chronic diseases to cancers to neurodegenerative diseases, whatever the condition might be, my biggest message to them is nothing that I can do for you, just like you said, no amount of bioidenticals or nutritional supplements or IV therapy or detoxification or gut rehabbing. None of that is going to do anything unless we release the emotional pain and trauma. And, I always, and I'm sure you do as well, I mean, just talking about mindfulness and meditation and staying in touch with yourself and self healing, self compassion, listening to things that raise your vibration, surrounding yourself with people who enhance your positive vibrations rather than bring it down. And then now, what we're talking about, the herd model, I mean, just to try to get to the core of where your disease process began and what was the trigger, because the trigger is not always a physiologic trigger. A lot of times it's a emotional, mental, spiritual trigger of trauma and pain. So with that being said, and want to respect everybody's time, what are some things that you can leave the audience with that they can do, some tangible and even immediately achievable actions that they can do to begin to reverse some of this? Is there anything that you can, let them start practicing that today?
Yeah. So there's a whole program I do called Healing Trauma Through the Chakra System that has 9 modules. It goes into a lot of depth on this, but there are some easy things that we can start with. And in my book, Solving the Autoimmune Puzzle, I have some worksheets too. I'm going to do a couple of those, one of those worksheets right now, because the hurt model isn't just about here's how it all works as a theory. It's also here's what you do, right, to start that digestive process. And one of the very first things that you can do is just start monitoring your language, and I'm not talking about shit damn and hell, but just like for 24-hour period, monitor how you speak to yourself and notice how many, not necessarily recriminating things that you're saying about yourself or to yourself. Maybe that's true too. Maybe you aren't nice to yourself and you're critical to yourself, judgmental to yourself. Notice that. But then also notice like how often you have thoughts, feelings, images that will come up that are signs of resentment towards something, whether it's another political party or, anything with government right now is really triggering people all over the place.
Right.
Or it's just any place where you might have a past hurt or somebody that came into your head and you're like, ugh, so notice how many times that you can flag resentment and start working with that, journal about it and say, okay, that I call those portals, those are the portals we want to go through to really know like, oh, that's a place that we need to play with and work with and start to dissolve. Right.
Absolutely.
Your mental chatter is 94% recycled every day. You've already had the same old thoughts every single day. Only about 6% that is new. And that might not even be worthwhile holding on to either. It might just be garbage. Right. So that's one of the reasons for developing a self-awareness, an observer's mind of yourself, not of everyone else, of yourself.
Right.
Where you can start like really tracking your own way of thinking and what you come up with your meanings and beliefs for all things you're seeing and experiencing. And then notice how many of those are in a space where you feel vindictive or resentful or sad or still have a lot of grief or you're angry or you're afraid, any of those places where it could go with a fight, flight, freeze, faint pattern. Right. Because your body is engaged in that right now if that's happening. Sure. And for every 5 minutes you're upset, it takes your body 8 hours to recover.
Isn't that something?
It's important to do this, like to develop that observer's mind, and quit being out here with everyone else, do it right here. And so that's the first tool that I find most helpful because then it can guide you into what to do next, what's step, right? But first you've got to be really aware of the terrain.
Awareness is definitely, you're absolutely right. That's a great tip, to start with just observing where you are and what kind of self-talk you're doing. The only other thing I would add is just start a gratitude journal. That is the highest frequency emotion that you can be in, is just be grateful no matter what you're going through, no matter what the situation. There's always a few things you can find that you are grateful for because you woke up today. Hey, your family all woke up today. You are surrounded by loved ones. Whatever it may be, I think would be pretty amazing. So for all the cancer thrivers out there, it is World Cancer Day, and both Keesha and I salute you and honor you. This is a journey that we share with you, and we'd like to honor every single person out there. who has fought the good fight, and we are still in it together. And we will honor you and pray for you and hope for healing for every single person out there. Keesha, thank you so much. You've been just a wealth of knowledge, and I really appreciate having you here today. Please look up drkeesha.com. She has tremendous amount of resources on her website. Get her book, join her in her community, and keep learning from her about how you can heal yourself. So good to have everybody here today. Take care. Bye-bye. Have a good one. Take care. Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.